These interventions and approaches that you will see demonstrate how we can adapt what we are doing using data to ensure that we're providing the best possible care to the patient in a way that matches what is needed rather than a one-size-fits-all approach.
Population health management is the future of how we need to address our patient needs, and applying the segmentation that is within John Hopkins' algorithm is a really good example of how we can use this. John Hopkins very cleverly divides our patient population into 11 segments according to their patient needs, and that is defined by how healthy you are or how many long-term conditions you have, your use of medication, hospital admission, use of the system. So really a lot of different ways in which information comes in put you in a segment between 1 and 11, and that divided into categories: green, amber, red. Green being your healthy population, amber being if you've got a couple of health conditions or chronic conditions, and then red if you've got multiple complex health needs.
If a patient would like to access care, they can do that in 3 ways. The first is the online route, and now over 75% of patients utilise this route. We've then got the access on the telephone, but that's much improved now because so many people are online. Patients can also just walk in, and that means that they can access the care that they need, but they're all risk assessed along the same triage method, which means that everybody has the right chance to get the care that they need, and it's prioritised.
When we looked at different software to move to last June, we looked at how we could integrate it so that when the request comes through, it shows both a patient RAG rating and a problem RAG rating, how urgent it is to be seen on the day for those specific symptoms that they've come through with. We use a patient health teams model. That means that our patients see their usual team rather than a usual clinician.
For us, it just means that everyone is being treated exactly the same. So after the platform has scored the incoming requests red, amber or green, they're also ranked so children will always appear at the top. Our care navigation and clinical team know to work their way down the list. It might be a green issue on a red patient, so therefore we would have raised that with more urgency than a green issue on a green patient. One of the other benefits that we found is that patients are able to see the same team of clinicians. It also makes it easier for us as a team of clinicians when we're doing meetings. I can meet with team 1 and discuss the team 1 patients. I can meet with team 2 and discuss their patients, and there's minimal overlap.
So for patients, they've been able to benefit from an improved access and improved continuity for their care, being part of a patient health team which surrounds them and helps support them. As staff, we've been able to access more learning opportunities. Clinicians have more information from the digital triage. They've also got the opportunity to develop in their roles. As a practice, we've been able to gain benefits because we can manage our flows much better. We're more efficient with how we work through, particularly our on-the-day work. But also our long-term condition work as well has now got this risk stratification, which means we prioritise the right patients.
And initially we had certain registers, so our housebound patients, our palliative patients, our MDT sort of list patients. Now what we can do is use our segmentation scores to bring in some of those more sort of amber and red patients that may not have even appeared in that search before, which has been really powerful to find a cohort of patients that we didn't traditionally have. There's so much data and so many diagnoses that are coming through that sometimes just having that segment on your triage tool or in your clinical system draws your attention to something else.
Having the population tool has helped us to better stratify the way that we're doing the structured medication reviews. Red patients are at higher risk potentially of a hospital admission due to inappropriate polypharmacy, so if we can focus on those first, it will hopefully help reduce hospital admissions. I'm a prescriber, so I run a hypertension clinic, and for those patients, if their blood pressure is not to target, I think the red, amber, green approach has helped me to decide when it might or might not be appropriate to up-titrate medication. In our upcoming PQS work, we've got 41 patients in a cohort for structured medication review. So we'll look at the red patient first, then move on to the amber, and then the green. And before we had this tool, we would have just maybe done them in alphabetical order.
The good thing about segmentation is that it's live, it's a dynamic being. So my encounter with my green 4 patient might uncover a new diagnosis, a new problem, and by inputting that problem into our electronic health record, that feeds back into the segmentation score, and the next time I deal with that patient, I might see them as an amber 9 and not a green 4, so that can inform our management going forward for me and the rest of my team.
We're working with our local acute hospital to see if this can be developed in the acute hospital trust emergency department, but also other outpatient departments as well. We're also looking to see if this can be part of a national direction on segmentation and digital triage and help inform processing and discussions that happen at that level.
The other opportunity that I feel for segmentation is in the prevention area. This is something that I'm really keen on. How do we keep you healthy? You know, if you're a patient that's in the green, how do we keep you green? That means earlier detection of pre-diabetes. That patient receiving that information, making the health changes, you know, losing a bit of weight, being more active, and not becoming diabetic. If you're borderline hypertensive, us detecting that, so you'll still be in the green. How do we keep you from not getting complications of high blood pressure? If you're in the amber section, yet again in this prevention space, if you've had one event, so you've had a heart attack or a stroke, how do we stop you from getting the second and the third? Because it's in every hospital admission that your health status is more complex. So if we identify you early, we treat you comprehensively, you know, how we will be able to keep you in the amber section instead of progressing onto the reds.
As you can see, there's lots of fantastic work going on across our geography to really innovate using data and transform the care that we're offering to patients, communities and populations. But there's a long way to go, and population health management and data-driven change is a golden thread that runs through what we're aiming to achieve to improve things even further, tailoring our services and pathways to the true needs of our population to keep them healthy now and in the future.